हेलो फ्रेंड्स, वेलकम बैक टू माय चैनल। आज का जो वीडियो है, आज हम लोग बात करने वाले जो व्हाट इज़ फार्माकोलॉजी एंड व्हाट इज़ द ब्रांचेस ऑफ फार्माकोलॉजी एंड व्हाट इज़ द एप्लीकेशन ऑफ फार्माकोलॉजी, दिस ऑल अबाउट दिस टॉपिक। तो सबसे पहले देखो, जो फार्माकोलॉजी जो टॉपिक है, every medical profession has to read this particular subject. Either it's MBBS or BDS or maybe physiotherapist or pharmacist, nursing. Everyone has to read this subject. This is very important subject because whatever drug we are going to use for the treatment, we have to study in this topic. So it's basically the subject which deals with the medicinal drugs and these drugs uses and the adverse drug reaction. So the pharmacology came from a Greek word, and it's a combination of two words. The first is the pharmakon and second one is logos. यानी कि जो फार्माकॉन जो होता है, फार्माकॉन मीन्स ग्रीक में इसे क्या बोलते हैं, ड्रग, और लोगस का मतलब कि स्टडी. सो इट्स अबाउट द स्टडी ऑफ ए ड्रग. दिस इज फार्माकोलॉजी. And in the pharmacology, basically before starting that topic, you need to know that whatever drug we are taking in our body, it has two action. What two action? First, it should give some benefit to our body, means it should cure our disease. After that also, that particular drug also produce some kind of adverse drug reaction or the side effects. We need to concern about the both thing. If the usage is more and the adverse drug reaction is minimal, that time we can use that particular drugs in human. So let's start. Then the pharmacology have basically two branches. One is what na pharmacokinetics and another one is pharmacodynamics. So the pharmacodynamics deals with what drug does to our body. In the sense, suppose if you are taking a medicine, that medicine should have some kind of mechanism. Whenever it's going inside our body, it will show some kind of mechanism, like in which process or which mechanism it's able to cure our disease. That's about the pharmacodynamics, means what drug does to our body. What can drug do to our body is that first is cure. So in which process it will going to cure our disease, that study is about in the pharmacodynamics topic. In the major two branches in pharmacodynamics, it's about the drugs mechanism, how it's going to cure our disease, that is pharmacodynamics. And another topic is that in the major branch in the pharmacology is the about the pharmacokinetics. Pharmacokinetics is that how our body react to the drug, means whenever we are taking that medicine, it will show some action, right, and it will cure our disease. That's in the dynamics part, means how it will going to cure the disease. It's in the pharmacodynamics. And in the pharmacokinetics is that whenever I am taking the medicine, how my body is reacting to that particular medicine, a drug. So whenever I am taking that medicine, whenever it's going inside my stomach, that time what is happening, first thing is that it need to degrade, means I'm taking a medicine in the solid form, right? So it need to break down in our stomach, in our acidic pH or in the HCl, the presence of HCl. After that, what it will happen, it will become more soluble, or it will going it will degrade in the time, in 10 minutes or 15 minutes. After degradation, it will go to our systemic circulation, and the systemic circulation will circulate the drug wherever that particular drug is needed. So in the kinetics, what is happening, kinetics has total four sub branches, that is adsorption, distribution, metabolism, excretion. Whenever I am taking the medicine, our body should react in the four process. I am taking the medicine, first is what, adsorption, then what, AD. D means what, the distribution, it should distribute all over the body or wherever the drug needed. So after distribution, what is happening, like Metabolism is there. Metabolism in the sense that whenever I'm taking the medicine, it's not that it will always is able to excrete. It need to be like more soluble or sometimes more insoluble, whatever. Like in different process, it will going to excrete from our body. So in metabolism portion is that it's about like how the particular drug will change its like moiety, means structural moiety. Maybe some kind, sometimes like OH will add from like enzymatic reaction in the liver, or sometimes like CH3 group will be removed. This all process, this all comes under metabolism. And in the excretion part, that particular metabolized drug will going to excrete in our urine. So this all thing our body is showing whenever I am taking the medicine. First is absorption. After absorption, what is happening? Distribution is happening. After distribution, to where? Distribution to all over the body, or where the particular drug is needed. Maximally it will distribute all over the body, and whenever like a receptor is needed, that it will take that, and it will means attach drug and receptor will be attached. So after that, what will happening? Metabolism will occur. After metabolism, what is happening? Now excretion is occurring. So this is the part of pharmacokinetics and the pharmacodynamics. So pharmacology is basically the study of, like, it's a science which deals with the about deals in the drugs, like how drugs will going to act in our body, or how it will show the action, or how, like, what is the uses and what is adverse drug reaction. So in the pharmacology subject, we can consider that pharmacology and toxicology. Toxicology in the sense like whatever drug I am taking, that need to be evaluated properly, that it is also having some kind of adverse drug reaction or the side effect, and that side effect we can't avoid, means we have to know that. Because whenever like I am putting some dose in like some condition, like a patient is overdosed with some drug, so we can know that this all effects are happening, may happen in, because since we know that if I'm taking that medicine, it has some like side effects, and this is the specified side effect. So that side effects we can cure from the side effect side also. So this is the thing. And after that, it has major two branches. One is pharmacokinetics, and another one is what? No, pharmacodynamics. And dynamics in the sense is that what drug does to our body, what is like how in this particular point, what in the major subject, like in the pharmacodynamics is that like how like a drug is going to act in our body, or and all those things, like what drug does to our body. It's give us the healing, right? And how the healing is occurring, about all those things. And another one is that pharmacokinetics, the kinetics part, what is happening, like how our body which react to the drug, like when I'm taking the drug, so how my body is responding to that drug. First what, it will absorb. After that, what is happening? Distribution will occur, like drug distribution. Then what is happening? Metabolism is occur. Then after that, like excretion will occur. So this is the part of the like pharmacology, like two major part. And after that also, like we have so many application in pharmacology subject, is that first of all that you can work as the clinical pharmacist. Clinical pharmacist in any hospital, you can work as a clinical pharmacist. After that, you can work as a preclinical scientist, means if the new drug is like someone has discovered, so some company has discovered, you can do the preclinical evaluation in the animal, means is that drug is safe in animal or not. So after that, you can choose the academic field also, if you are like reading pharmacology, and if you have good knowledge in pharmacology also. And this have the all means many application in the pharmacology. Later we are going to know about the receptors, and how many types of receptors are there, and what is the different kind of drugs are available, and what how they are going to act in our body. About this thing means next class we are going to start with the like receptor theory, how many types of receptors are there, and what is their mechanism, what is G protein coupled receptor, and what is the ion channel receptor, what is enzyme receptor, all those things we are going to know. Thank you so much.